Firstly, please take it to your mind, allow for the golden minute. When dealing with an angry patient, the golden minute may feel like the golden hour. However, in this context, it is absolutely vital to allow the patient to get everything they are dissatisfied with off their chest. Keep an ear out for any subtle hints they may drop. Later in the chapter, we will discuss Maslow's hierarchy of needs, which will explain this better. Ensure you listen for words such as tired, hungry, pain, and so on. These are all simple causes of anger, which are all easily rectified if picked up on. There is a tip if you participant in the OSCE, pay attention to the body language, which we mentioned in the chapter 2. If the patient is standing or stomping around, sit down and ask them politely to join you, somewhere quiet or where you can sit down. Be wary of crossing your arms. This can often be interpreted as a defensive stance. Keep it open. Maintain eye contact. The use of nonverbal signs that you are listening is the key. Get them on your side. It is almost important to be angry with someone who is acting rationally, let alone if you are viewed as their advocate. Once the golden minute has run its course, apologize. Hey guys, this isn't an admission of guilt, and even if you are in no way associated with the events which have caused the person with whom you are talking to become angry, an apology is always appreciated. An empathy sorry about that will win you no favor, though. Make it pertinent to them. If they say they are cross, they have been kept waiting, use that. Something as easy as, I'm sorry you have had to wait so long, can start to get the patient to acknowledge you are on their side and will make the rest of the consultation flow in a more positive way. Many people struggle with certain empathetic concepts, and below are few of the most common. What do you say and do after giving an empathetic response? What if I just cannot empathize with this person? I don't have time for this. Surely this isn't relevant for a doctor. This isn't my forte. So how can we avoid the above? First of all, one of the most useful things to do after offering an empathetic response is to simply do nothing. You will be in a highly emotive environment, sitting quietly for a few seconds, with the other person will allow both of you to take a chance to think about the situation you are in. If you think you cannot empathize with someone, you are wrong. We all have the base ability to relate to those around us. It is an important survival mechanism. Many of us are fortunate enough to have never experienced the loss or illness of a loved one, but we have all been scared for something. Try to sit back and think of what you want to hear when you are scared, how somebody could help you. Use these overall concepts to offer support to your patients, and you will both benefit from it. Obviously, exploring strong emotion is a lengthy process, and in an OSCE or a busy world, you may feel like you do not have time to get involved in such situations. Realistically, however, it can make a consultation all the more efficient by addressing the elephant in the room at the onset of a conversation to allow for a more open discussion later on. Finally, anybody who thinks empathy is not for doctors is really rather wrong. We have a duty of care for our patients, This is not limited to abnormal physiology, but also to their mental and emotional health. If a person were to have a negative experience during their stay, they may avoid healthcare professionals in the future, which might subsequently have a long-term effect on their health. By allowing people to explore how they are feeling, you can make the world of the healthcare more accessible to them in the future and optimize their health going forward.